here in the Catskill Mountains with Dr. Scott Rosa, and we're really happy to be here and to have the privilege to interview Scott for this TV show today. And I'm your host, Doug Sharp. This is my co-host, Rich Geer. And we've been out here for, 10 days. 10 days. And we're treating my sister Carol and his wife for an accident that took place 12 years ago. And I want to start out with your little narrative of what happened that led to this us being here right now.
Well, to me, it's quite an amazing thing. Obviously, Carol, she was injured in a hospital, and they told us it was hypoxia, lack of oxygen to the brain, global ischemia, which means both hemispheres were damaged into this thing, and we didn't know what else. We were stunned. Obviously, our whole lives were changed. My lovely bride was taken away from me. She was still alive, but anyway, it's been a long time. But when Doug and I were asked, actually Doug was asked to go out for us to interview a very good friend of ours, Dr. Raymond Damadian, who is the inventor of the MRI. We've done some shows with him. He thought he could help Carol and wanted to take some scans. And then he mentioned Dr. Rosa, and as we were going in, they're doing some incredible work, amazing things going on. Well, one thing leads to another, and how these kind of things go. But it was the first sense of hope that I've had in 12 years. And when he said we could do something for Carol, I thought to myself, what have I got to lose? Even though I didn't think she was not on the gridiron like Jim McMahon did. There's both Dr. Rose and Dr. Damadian talked about Jim McMahon. They've done some amazing stuff with him. I think we'll probably talk about it a little bit if you want to. But anyway, I thought, well, what have I got to lose? So we brought her out. And of course, it's the axial, right?
The Atlas.
Atlas. I'm sorry, I was getting that wrong. Yeah.
It's okay.
The axial orthogonal machine is what you use, right?
The Atlas orthogonal percussion instrument.
See,
it's a tongue twister.
It's a tongue. Okay, say that again.
Atlas orthogonal percussion instrument.
Anyway, yeah, and we were stunned. Four of us. Doug was there, and myself, and Dr. Damadian, another doctor, and then Mary, the tech, was there. And sure enough, all the top one was out, but the second vertebra was out. The four after that were out, and we were all kind of stunned. My son-in-law, who happens to be an MRI, he's a PA. He schedules MRIs every day. He wanted to see this upright MRI, and he looked at me, and the ventricle in the brain was swollen.
Both of them were. Yeah.
Both of them, yes. Both the ventricle, which is the sac that produces the fluid. Am I right on that?
It's the sac that causes the ability of the fluid to get sent out to wash the brain and spinal cord. It does get created in there, and it does get filtered in other places. It's a little bit of a complex system, but the ventricles are the key sacs that pump out the fluid that's responsible for bringing nutrients into the brain parenchyma, and most importantly, removing metabolic waste and toxins from the brain to keep the brain healthy.
Is that somewhat of a fairly new idea? I'm probably getting a little off subject, but about the only thing I knew about cerebral spinal fluid is when it gets on the brain, swells it up, it puts pressure, but then you relieve the pressure, and that's about all. It wasn't about removing toxins. It was about cushioning the brain for head injuries and that kind of thing. Sure. Is that something new? I just wanted to ask that.
It's an interesting story. As you met Dr. Damadian, he tells the story quite often about how when he was a med student, in about 1960 or 61, he was asked to go get a spinal tap, basically pulling fluid out of the spinal column to do an assay of the actual fluid. And he discusses how in those days they thought that the spinal fluid was nothing more than a fluid to keep buoyancy in the brain and kind of cushion the brain from shocks and movements. What they didn't know is that the fluid actually pumps and moves with every heartbeat, every cardiorespiratory cycle. The spinal fluid pumps. And as of about the last 2 to 3 years, they've discovered that not only does it pump, but they've discovered that it actually, creates a washing action in the process of the pumping in such a way as to be able to remove metabolic waste and toxins. And we're actually looking into the potential inflammatory things that can occur as a result of that fluid not being able to appropriately wash out those neurotoxins.
Right.
And that's been discussed in the literature actually the last couple of years.
So it's fair, but it's fairly recent as far as that goes. As far as
It's recent in terms of being able to view it
Right.
in vivo. Thank goodness to Dr. Damadian and the Phono Corporation for developing
Right.
the software to be able to visualize this. But it's not something that has been very widely done for many years, and it is more recent that they've actually learned or have created the ability to actually image via a real motion movie of how the fluid moves or doesn't move.
And that's fairly recent then.
That's fairly recent, sure.
Yeah.
sure.
That's an
No,
amazing development.
we really never lost hope on Carol. Even after 12 years, we had people praying for her and asking God for a relief, because this didn't make any sense why this should happen to us.
No, and yeah, you're right, Doug. And Carol's my wife. It's Doug's sister, okay? And 12 years, but this Dr. Damadian and you, Dr. Rosa, are the first real, actually empirical kind of hope we've had. We've had hope as sort of like been maybe a faith hope, or there was one thing I did, and I've been doing for the last 12 years, hyperbaric treatment, hyperbaric oxygenation, which apparently you're a fan of, or at least
Yes.
it does help. And we went down there originally because perhaps some of the stunned neurons could be reactivated, or we didn't really, this was 12 years ago, they were just barely beginning to realize that brains could regenerate, let alone they knew they could recirculate, or recite, I don't know, what's the word I'm trying to think, reconfigure, I guess. If
They
something
can create new
was
pathways.
New pathways,
sometimes,
yes.
Sure.
And so those are things. And I think it's helped Carol stay physically fairly healthy, and I think it's helped her in maybe even the brain activity. But the actual seeing of a when the MRI showed that stuff, and then what was amazing is, I don't know, when we came up here, we were there a year ago, August.
Mhm.
So it's almost a year, Doug, when we first were out there to do the interview with Dr. Damadian. Then it was another 6 months before we were able to go back to get the scans, and then another 4 months you were able to review them.
Mhm.
And what did you think when you first saw those?
Well, it was very interesting. I actually got a phone call from Dr. Damadian once Ellen had sent up the scans for me to take a look at.
Mhm.
And Dr. Damadian's first question to me was, have you ever seen anything like this before? And my answer was, yes, I actually have seen it quite a few times. Meaning the enlarged ventricles, which is termed ventriculomegaly, and all the white within the brain parenchyma was indicative of there being just way, way too much spinal fluid. It showed that there was kind of a pooling and not proper movement of that fluid. So I have seen this on numerous types of cases. So he asked, had I ever seen this before? And I said, yes. And then, of course, what I look for when I review a scan on any patient considered for treatment is I look at the base of the skull at the craniocervical junction to see if there's any misalignments or derangements of the atlas bone within the articulation with the skull and the C1 in terms of its relationship to the C2 bone. If we see that there is malformation or misalignment of those vertebra, those segments, then we believe that the patient probably would be a candidate. We never can guarantee, we don't know what outcomes are, we can't predict that. But if those findings are there, then we feel that correction of those misalignments might very well bring about some improvement, some comfort, some healing, and that's the rationale for why we accepted Carol as a patient, with our hopes of being able to restore those bones into a more normal position with the impression that that would help to improve the flow of the spinal fluid, help to decrease the pressure against the brain, which has probably been very inflammatory for her, and just get her as comfortable as possible and create an environment for healing.
Did you say the fluid, every heartbeat, it's pumping fluid in it?
Spinal fluid pumps with every cardiorespiratory cycle.
Okay.
So every heartbeat, which is synchronized with breathing, the spinal fluid will pump. And it pumps in the ventricle, it pumps in a wave. So almost the way the heart chambers contract to squeeze out blood, ventricles do a similar fashion. With the cardiorespiratory cycle, they'll squeeze the fluid out of the sac. It's supposed to go around the brain and then out of the base of the skull down the spinal column to go ahead and bring nutrients and remove metabolic waste from the spinal cord. So it's like a radiator, a closed loop system.
Sure, yeah.
So when you adjusted Carol, it was a week ago Monday, what did you see happen at that time?
Well, most importantly, we never can predict what happens after treatment in the terms of we don't know how much time it takes for someone to respond. Some patients respond quicker, some patients respond slower. It depends on how long the problem has been there and to what degree. As an example, the famous quarterback, we were honored to treat Mr. Jim McMahon. Would have been nicer if he used a little bit of a different analogy, but he described it as soon as we rendered the alignment, the correction of the misalignment, he said it felt like a toilet flushed, literally. He said he felt the fluid in his head that had been squeezing his brain and creating a potential brain fog, and he had severe headaches. He felt like he had ice picks in his brain. Somewhat within about 5 or 10 minutes after the treatment, he said that pretty much abated. So some people goes quick, some people go long. But with Carol, the amazing thing that I certainly observed, which I think I mentioned, God showed up, because I've never seen anything like it that quickly. We know that Carol had been fussy and uncomfortable, but after rendering the treatment, by the time we got her off the treatment table and put her back in her chair, there just seemed to be this wonderful calming effect that I think continued to, become more prevalent as days went on. She did receive and did need another treatment 2 days later. That was on Wednesday, but since last Wednesday, today being a week, she has not needed any further corrections, and the trend seems to be that she's in more of this calmer, more comfortable state.
Yeah, that's what I've been noticing a lot, and we've had an aide with us on this trip, and coming out, and she's been documenting little. It's a lot of small, subtle, but real cumulative things that seem to be happening with Carol, and so we took the chance yesterday to try to go back down and get some more scans, but that was kind of that might have been we did get some information that seemed to be valuable for you, because the second set of scans kind of tells what, if any, progress is happening, and you could actually see some of that, right?
It was a bit of a challenge for Carol, because going down from where we are to Melville, the corporate center, it's usually about 3.5 hours, give or take, depending on traffic. So it's a long trip down. The scan it's very hard for her to sit still, and I'm sure it was very fatiguing. But we were able to go ahead and get at least 3 sequences that were the same as were done on the initial scan, that we are able to compare. And we've gone ahead and taken a look at them. And there are some very nice subtle changes in the span of about 7 to 10 days. And oftentimes I see these things take months and months to show changes, but we're seeing some very nice changes, and it's very encouraging.
Yeah, that was good. What the specific thing you said that the ventricles?
So what we noticed mostly would be the following. We noticed certainly one of the ventricles, the left ventricle, seems to be a little bit smaller than it was, meaning that there's obviously less expansion of the ventricle, which means that somehow we were able to decrease the amount of pressure that was squeezing against the brain that might have contributed to the development of that ventriculomegaly, or the enlarged ventricle. We saw a little bit less of the spinal fluid in and around the brain parenchyma, which means that the fluid started to drain some, which is what our prayer and hopes are, is that the brain was just having too much fluid in and around it. It was becoming very, very inflammatory. Another thing of note that was very encouraging for me is that on the original scan there was some distortion in the brain stem. When you looked at it from the front, the brain stem kind of looked zigzagged. And after this new scan that was performed yesterday, the brain stem is as straight as we can hope for. So there seems to be a good change in that, and the brain stem is responsible for taking the messages from the brain and bringing them down into the spinal cord, and then the spinal cord, of course, has the nerves exiting out to create normal function or improved function. So I think we've noted, and Amy, the wonderful caregiver, has stated that there have been some changes that you guys have noted in terms of her, not just comfort. I think you mentioned something about her left arm has been able to move a little bit.
Yeah, move it and more relaxed. It's still quite tense, but it's actually opening up a lot more than it did before.
Sure.
The right one was always able to be a little bit more open, hand more straight.
Sure.
This one is still kind of bent, but before it was kind of like if I stretch it out, pretty soon it would kind of come up like this. It was very rare that it would ever do much more than this. Now it's able to come up quite a bit away from the body.
Yeah,
so.
All good signs. Another one that I think is very important is that I think when I first met Carol, it's almost as though her head was stuck, torqued, and twisted to the right. And now she's been able to move that head more towards a neutral position, and to some degree actually turn a little bit the opposite way.
She does turn, especially if she's like this morning. We were out in we were out in Dr. Rosa's office out here, and we were talking, and Doug was over here. She turned to him. She turned to Amy. She turned. I mean, it was amazing. We were watching that this morning, and that was very responsive.
That's incredible news, and again, very, very promising. You know, I believe that this tragic event that occurred, I think that in the process of what happened, something mechanically straining got into her neck, a force, a stretch, a pull, something caused that neck to torque. And then I think that in the manner that which it torqued is what led to the malalignment or derangement of the upper neck vertebra. And I think, you know, in respect to Carol, I think poor Carol has had a neck that's been twisted in that torque posture for 12 years now until we were able to go in there and thankfully due to the MRI showing us where the bones were out of place and using that as a roadmap for me to know where to gently set the bones back into position. I think that's been the beginning of the catalyst to try to help her start
Now,
to feel better.
you are thinking that this procedure may have indications for other brain diseases like Alzheimer's, Parkinson's, ALS, MS, autism, even cerebral palsy.
Yes, so I've been involved, it'll be 30 years in October I've been in practice, and probably about the last 15 to 16 years my focus has been research in the fields of neuroinflammatory and neurodegenerative brain diseases, which would include what you've described. So I've treated quite a few patients that have various forms of neurodegenerative brain diseases and neuroinflammatory diseases. We treat a lot of MS patients, we treat a lot of Parkinson's, we treat a lot of Alzheimer's, dementia, ALS patients, not a ton of them, but I have treated quite a few. And we have noticed in our imaging that we perform, thanks to Dr. Damadian and the wonderful technologies created, we've been seeing these common threads that are showing up, and our hypothesis, and it's nothing more than that at the moment, that's our due diligence to prove it, that's why we're in research in this. Our hypothesis is that in the same manner that cancer is cancer, it just manifests in different parts of the body, we believe that neuroinflammatory and neurodegenerative brain diseases might have more of a common thread than a dissimilarity. We just think that their manifestation is different. We actually have images that we believe demonstrate why in one person it might manifest as MS, excuse me, and why in another person it shows up as Parkinson's. But again, we're at the beginning stages of these. These are observations merely at this time, but very interesting. We've been having this hypothesis for about almost 12 years now. And about 2 years ago, researchers at the University of Virginia and University of Rochester medical centers did a research study. Until those points, they felt that the brain never had a system to clear out neurotoxins. As we know, we have lymph nodes. Lymph nodes are in the neck, the armpit, and the groins, and lymph nodes are filters. They basically filter out toxins in the body, so when you get a bug or a flu, oftentimes you feel swelling of the glands. That's the body's means of clearing out, toxins and so forth. So the anatomists and physiologists, believe it or not, never knew if the brain had a capacity to do that. They never discovered anything on static dissection studies of a system that can clear toxins. Well, with the advent of the spinal fluid flow systems that we're using today, they started using these tracers, these biomarker tracers, that they would put in the spinal fluid, and then they observed where the spinal fluid markers went, and they found out, they created a name for it actually. They call it the glymphatic system, GLYMPH. The glymphatic system, the terminology was glial cells are what are comprised of the brain mostly. So they call it the glymphatic system because they discovered that the spinal fluid is actually not just the fluid that keeps buoyancy to the brain and cushions it, but it's also the fluid that washes away the neurotoxins.
Well, this is what you've been saying. Now, you've been saying it for a lot longer, though, right?
Correct. We'll never get the credit for it. We've been observing this for again, we've been doing these CSF flow studies via Dr. Damadian's technology for going on at least 10, maybe 12 years now.
Wow.
So we've been observing it. We just never did the research of the tracers actually observing where and how the system works. But it was wonderful because their findings resonate with our observations and our hypothesis, and according to them in their papers, and they've written quite a few papers on it. In fact, I just got brought into a new research project on the glymphatic system that we'll be working on within the next year. We're excited about.
Oh, that's pretty cool.
But they stated in print that this new discovery of this glymphatic system, whereby the spinal fluid is essentially the fluid that removes toxins and brings nutrients in to keep the brain healthy and help it heal, they said is at the root of MS, Parkinson's, Alzheimer's, and they said potentially autism. So they're saying that essentially that fluid, if there's an impropriety within that system not functioning the way it should, that spinal fluid could lead to neuroinflammation of the brain and subsequently neurodegeneration of the brain. And that's where they're saying that there's this plausible connection between this lymphatic system malfunctioning and the onset of these various types of disorders.
Have they linked the what do you call it, lymphatic
system.
phenomenon? Have they made any links with the axial vertebra yet?
The atlas.
I
No.
keep saying the wrong thing.
That's okay.
Yeah.
They've identified that the fluid does what they never realized it did.
Okay.
They have not, it's only our group that have gotten into the understanding over the last 12 years that when there's these malalignments or derangements of the cranial-cervical junction, which is a term used for the atlas articulation with the base of the skull, and the atlas with the second vertebra. So we're the ones that connected the dots where when there's misalignment of the cranial-cervical junction, the top two vertebrae, the atlas and the axis, that can somehow correlate to a limitation or a dysfunction in the inflow and outflow of the fluid coming in and out of the base of the skull, because the atlas is the first bone that starts the spinal canal, and if there's a derangement of that bone, it can narrow the opening and start to cause a dysfunction in the normal flow of that fluid, the spinal fluid.
How do we clone you guys? That's the big question. We've got to make this treatment mainstream, and you have to have somebody like the likes of Dr. Damadian and you, who have worked together, and it's years and years of your experience that make it work. So
our prayers are, a good friend and colleague of mine who's an emergency room physician for about 54 years now, Jack Carlton. We've had these discussions at length because he's been alongside the research I've been doing for about 27 years now.
Oh, wow.
So he's a great dear friend and a colleague and a fan of our work. So he once told me that the doctor that invented the heart transplant is a doctor from South Africa. Dr. Carlton told me from the development of the heart transplant to the point at which it became available mainstream on a level that can be done accurately, safely, with good outcomes, it took almost 30 years.
it was Dr. Christian Barnard, right?
Yes.
Yep.
So I made the joke to you gentlemen the other day that I don't have 30 years, I don't think. But
hope you do.
no, well, between your mouth and God's ears. But what we have to do is we have the technology. The technology is there. The spinal fluid, Dr. Damadian's technology is available. What our challenges are is, and again, the burden is up to us, which we're doing. I hope to have several papers published within the next 6 months to a year. We're exposing the observations and showing our correlation of what we've observed to what we think is happening and how it affects the aberrant flow of spinal fluid and how correction of the alignment helps people to feel better and heal. So what we have to do is we have to first, be able to validate that what we're seeing is what we believe it is and we think it is. And then the next step, of course, is the training. And the training for doing the procedure of the correction, it is like brain surgery. It's not something that anyone can do. It takes a lot of understanding. It takes a lot of years of experience. And we do something that is, certainly proprietary to us. We do something called the image-guided atlas treatment, which is whereby I use the MRI images to help guide me to understand these misalignments and how to best correct them and what angles to use to be able to reset those bones in place. So at present I have one doctor who's a dear friend and colleague that has been training with me for over 20 years, and we are in the process of trying to train more doctors, but our concern is that we believe it's essential to help those that are suffering. There are millions. But we also realize that if someone attempts to do the procedure and it's not done properly, it won't only create a poor outcome for the patient that it might be applied to, but unfortunately, as you would expect, we're going to be under the scrutiny of many people.
Yeah.
Many people that are wanting to see us succeed and some people that might not want to see this succeed because we might represent something that might be different in what regular mainstream might want to offer.
Yeah.
Right. So we have to make sure that this is done on a scale of critical attention to detail expertise, because if someone fails at it, then something that could potentially help all of humanity when we're all dead and go on forever might go ahead and get skewed in a way that it shouldn't because someone just didn't apply the procedure.
Well, we talked about that. It's not merely sorry to mean to walk over you, but it's not merely a speculation on your part that's actually happened.
It's happened, and sadly, again, I'm involved in cases where people have had the wrong treatment done, and we never want to do that. I mean, there's no guarantee of 100% success with anyone, including myself, but when you know the work well and you understand the mechanics of it and you understand the application of the procedure, I think the likelihood of mistakes go down exponentially, and we try to make sure whatever we do it with the greatest of care and safety and good outcomes.
So it's important to have it's important to have this documented well, and that you get everything down pat as to what the research is, so that everybody understands what needs to be done. And how is this different from traditional chiropractic?
Well, look, traditional chiropractic has been successful for over. Chiropractic was created in 1895, so it's 127 years old, the profession, and the profession does great work at large. The work that we're doing is kind of a specialty within chiropractic. It's kind of like dentistry. You have the regular dentist doing the generalized work, then you have the orthodontist that straightens teeth. So we're a specialty within our own profession. So the difference we say is that the manner in which we do what we do is guided by things that most of the profession might not be using. So traditionally, most chiropractors will use X-rays. And I do.
Yeah.
But what I call our secret weapon is that I've developed and created a method by using the MRI to be able to help us understand the misalignment a little bit better. And a great example is an X-ray is a shadow and it's two-dimensional. And it's fine. X-rays been around since about 1918. MRI is three-dimensional with very thin slices through the joints that an X-ray in some cases can't see. So we say with cases of complexity, the MRI gives you a visualization or a window of information that X-rays can't. And that's where the methods that we've developed and the methods that we've patented and created have been done so based on the amazing technology of Dr. Damadian and the company Phonar. So when you ask the difference is chiropractic in general provides great care and great service. In cases of complexity like Carol, I think the benefits were is that the imaging, the MRI was this wonderful roadmap, three-dimensional, that helped me understand her misalignments, and that was able to help guide me to do a treatment that seems to be showing some good progress.
Well, we're going to have to wrap up, I'm afraid.
Yeah.
But I'm glad that we had the chance to interview you as well as to receive the treatment from you this time. It was worth our while to come out and visit you for the last 10 days, and we will be back probably.
Look forward to it.
And we appreciate everything that you've done for us.
Well, thank you very much.
And
It's been a great honor.
we'll see you next time.
Yeah.